so proud to be Haitian because just everything about being Haitian is just awesome.
You know, everyone know about the history of Haiti, first Black independent country in 1804.
Understanding the history of Haiti, Haitian people, you can't help but be proud of the accomplishment that have happened.
Haitian Americans have done really well in the past few years. There's still a lot more work to be done. Only about 20% of us actually have a bachelor's degree.
I understand firsthand some of the challenges that Haitian American students, graduates, and professionals have faced.
Some of them have overcome incredible adversity.
Both immigrated or asylum seekers or refugees.
There are not that many Haitian-focused scholarships, but like any other award, the NAHP Leadership Award is providing recognition for one's hard work.
As we know, college is expensive, so this scholarship fund provides the chance for a brighter future.
It felt like the universe was speaking, like I needed the money, I was intrigued, people were telling me to apply.
Going to college or graduate school can be very, very expensive. So donating to a scholarship like this would help that expense be more manageable.
Future generation of leaders, scholars, entrepreneurs,
young adults that are trying to make something of their lives.
They are rock stars. They just need the help, and they need us to help them accomplish it.
There's like this Haitian proverb that says, "Meilleur pied palu," many hands make the load lighter.
Log in and you can donate $10, $25, $50.
It makes me think of the Malcolm X quote that education is our passport to the future, for tomorrow belongs to those who prepare for it today. It makes me happy to know that our organization is contributing to that goal, preparing others for the future.
Thank you. Thank you. Okay. Am I having trouble talking? Okay, thank you everyone for coming today for the Unmasking the COVID-19 Vaccine Virtual Symposium. Before we begin, I would like to thank our partners, Truckerella and Book It Right Accountancy, for helping us bring this to you today. I'll also like to thank the National Alliance for the Advancement of Haitian Professionals organizers for the time and dedication they make to educate and inform the community. It has been a year now since the coronavirus emerged, disrupting our lives as well as our livelihoods. It shut down our schools, our businesses, and global economies. And in its wake, it resulted in over 2 million deaths worldwide and over 500,000 in the United States. 3 vaccines are being currently administered in the United States. Still, many people, especially the Black community, who has suffered at the hands of government and medical institutions, are hesitant about receiving the vaccines. So today, we hope to educate and inform people about COVID and its variants, as well as the vaccine's effectiveness and its distribution with our knowledgeable and wonderful panelists. I'm very excited to introduce the panelists. So if you get a chance, I want you to also read their amazing bio that's on our website. So let's begin today with Dr. Estelle Jean. Dr. Jean is a board-certified non-invasive cardiologist at MedStar Montgomery Medical Center. Dr. Jean received her medical degree from Rutgers and completed an internal medicine residency at Harvard's Mass General Hospital. She then completed a joint fellowship program in cardiology at MedStar Georgetown University Hospital and MedStar Washington Hospital Center. Dr. Jean's clinical and research interest focuses on prevention and heart disease in women. Welcome, Dr. Jean. Dr. Ernest Barthélemy is a chief resident in neurosurgery at the Icahn School of Medicine at Mount Sinai. Dr. Barthélemy was a Paul Farmer Global Surgery Research Fellow at Harvard Medical School and completed a Master's of Public Health degree in Global Health Population Studies and a Public Health Leadership concentration at the Harvard T.H. Chan School of Public Health. He's also the president and co-founder of the Society of Haitian Neurologists, dedicated to reversing the social consequences of human capital flight in Haiti. Welcome, Dr. Barthélemy. Next, we have Dr. Howard Laroche. He's an ER physician with JFK Medical Center in New Jersey. He earned his medical degree from the University of Pennsylvania School of Medicine. And he's not like a regular mere doctor like the rest of us presented today. Dr. Laroche wears many hats. He is the treasurer of Haitian Association Abroad, Association Médicale Haïtienne à l'Étranger, AMHE. He has an MBA from Catholic University, a CPE from American Association of Physician Leadership, and a Master's of Jurisprudence from Seton Hall Law School. Welcome, Dr. Laroche.
Pleasure.
Next, we have Dr. Joseph Durandis. He completed his residency in family medicine at SUNY Downstate, my alma mater. He's also board certified in hospice and palliative care. Dr. Durandis founded Excel Medical Associates in Miami. It's a medical group dedicated to primary care with the full scope of traditional family medicine. His organization has contributed to more than 10 fundraising events and initiatives supporting the fight against COVID-19 in Haiti. It has also raised more than $8,000 to support Hospital Justinian in Cap-Haïtien. Welcome, Dr. Durandis. Next, we have Dr. Sabrina Sumner. He is a board-certified internal medicine physician with a special interest in hospital-based practice. She obtained her medical degree at Philadelphia College of Osteopathic Medicine, Georgia campus, and completed a residency at Kepler Air Force Base in Mississippi. While serving in the Air Force, Dr. Sumner treated wounded warriors in Germany and served as a flight surgeon focusing on occupational medicine. Today, Dr. Sumner is Division Chief of Hospital Medicine for Geisinger Health Services in State College, Pennsylvania, where she resides with her husband and her 2 young sons. And it's also my hometown. So welcome, Dr. Sumner. Next, last but not least, we have our Doctor of Nursing panelist, Dr. Sandy Cayo. Dr. Cayo is a board-certified nurse practitioner who is a thought leader and an advocate for improving equity access to healthcare for all. She is the Vice President of Clinical Performance and Transformation at New Jersey Hospital Association, where she assumes leadership over the Health Research Educational Trust of New Jersey. She is the clinical investigator for a $3.5 million portfolio, which includes initiatives related to perinatal quality, hospital quality improvement, opioid abuse prevention, HIV prevention, and implicit bias training. Dr. Cayo is a founding member of the Greater New York City Black Nurses Association. Welcome to all our wonderful panelists. So this concludes my introduction of the panelists, and let's proceed to the question that we are dying to find the answers to. First, I'll start with asking specific questions to specific panelists. And after they answer, any of the panelists that wants to add to their comments are free to do so. Once all the panelists have addressed their questions or answered their questions, I will then have general questions that any of the panelists could answer. And also, I ask the viewers that if you have any questions that you would like to pose, please feel free to do so. Okay, so let's begin with the questions. Dr. Laroche, we're starting with you. Now, some people are hesitant to take the vaccine because they believe that the vaccine was rushed. They believe that some steps were skipped along the way. What do we tell to these people?
Well, first of all, good evening, everyone. It's a pleasure for me to be here and have a conversation with you regarding COVID-19 and vaccine. I must say to you that my remarks are going to be in the new dialect called Creolish, which is a mixture of Creole and English. So bear with me. So very important question in terms of the vaccine and the hesitancy program that people have and the variants. I believe that's the first question that you have as far as variants. Variants or strains, sometimes they call it, is because one, the material that the virus has and its outer coating may change. So I'll do better. Let's do an example. For example, if you look at this is an orange, right? But if you look at the orange, on the outer coat of the orange, there's some blue tab that's sticking out. These are what we call the spike protein that technically that the virus has. So let's say this is the original virus, okay? It has the spike protein. When we have a vaccine, the vaccine is made to recognize that virus. But then we have other virus, which is like a variant virus, and then now the virus mutate and change its coding. Now, what you can see is that it's still the same orange, but in this case, the color of the spike protein has changed. So which means that the vaccine that we gave towards the blue-coated spike protein now may be slightly different, and therefore the virus may for a while kind of navigates in our system, and then our immune system will recognize it, but eventually will do. So that one we'll call our UK variant. This is the regular virus. This is the UK variant. But then we also have this other variant. Again, the same orange, but now what do you see? The outer coating now has green and round. So again, it's a different formation, a different key that allowed that virus also to enter our system. And as a result, that virus may be a little bit more virulent. For example, the UK virus, we know that's about 50% to 70% more transmissible and also could be more deadly. But we also have the South African virus. So in total, there are 5 variants of the virus. Now, let me say, I heard of 3, but there are 2 more variants that have been recognized, but they're not as deadly or as problematic. They are the California variant that was discovered in July, and then they have the New York variant that was discovered in November. But these are not as problematic as the top 3. Our top 3 being the UK variant. I call it the European continent variant because if you look at the different continent, it comes from Europe. And then again, that's the one variant. Again, more transmissible, more deadly because of the outer coating. Then you have your South African variant that was discovered in October, and I call it my South Africa continent variant that also has some changes, like I show you under different protein spike. And last but not least, we have the Brazilian variant that I call my South America continent that come from a town of the area of Manaus, where you have more the Amazon jungle, and that also could influence why the variant is such. Now, one of the up to this point, these are the main variants that there are that can also affect our immune system, and that may also not quite get us into trouble, but the immune system will rapidly develop some defense mechanism against that variant.
Well, Dr. Laroche, we're going to get to the vaccine soon, but with so many of the variants, the vaccines that we have now, are they effective against them?
Okay, very, very good question in terms of effectiveness. Again, I won't touch the percentage. However, from what they have seen so far, most of the vaccine are effective against all those different kinds that we have. However, they are less effective against the South African variant or the Brazilian variant. Now, some vaccine themselves, for example, the Johnson & Johnson, the Pfizer, for example, has the same kind of effectiveness against the natural one or the UK one, but however, slightly different than the others. So to answer your question shortly, is that they are effective, but to a lesser degree.
All right, thank you. Thank you for that, Dr. Laroche. Dr. Sumner, can you remind the viewers again of the 3 available vaccines that we do have, and how are they different, and how are they protecting us? How are their efficacy? She's on mute. She's muted. Yeah.
Okay.
Okay.
Thank you, Dr. Thank you, Dr. Crevecoeur. Can you hear me?
Yes, now we can.
Okay. All right. Thank you so much. I'm grateful for the opportunity to speak with everyone today. This is such an important topic of vaccination. Before we step into this, the actual introduction of the 3 approved vaccines and what they are exactly, I just want to highlight something I think is very important here. It's a very important message to take away from this. The more people who are protected against COVID-19 through vaccination, the less opportunity this virus has to mutate. Yes. The less people become severely infected, and we as a global community are in a better position to end the pandemic. So with that in mind, definitely let's introduce the 3 currently approved vaccines in the US right now. So currently we have, as we know, the Pfizer, BioNTech, and the Moderna. These are mRNA vaccines. And then we have the J&J Janssen, which was recently approved, and that's a viral vector vaccine. So what are these vaccines? How do they work? These are basically, vaccines which are different from the historic vaccines to a certain degree. So vaccines historically are really just something that they give the body some type of inactivated germ, and they're put into your body through a vehicle in a shot, which triggers an immune response. And the immune system develops a memory, similar to what Dr. Laroche was going through there. There are some differences with these new vaccines in the way they present the information to the human immune system, but the technology has actually been around for about 2 decades now. mRNA is messenger RNA, and that's a molecule that actually synthesizes proteins. So the 2 mRNA vaccines, they use this molecule to help human cells make their own version of the coronavirus spike protein that Dr. Laroche had as the little spikes on his orange there. The body can then recognize it and remember it and build immunity against it. So specifically, some of them to everybody. With the mRNA vaccines, they're rather similar. They're both 2 shots given roughly a month apart. The Pfizer is within 3 weeks, and the Moderna is given 28 days after the first injection. Both are intramuscular injection. Importantly, they don't contain any eggs, latex, preservatives, or other things like that. They're really they're approved for mostly adults, the Pfizer being approved for 16 years and older. They were studied in the clinical trials for children 12 years and older, but the approval only went out for the 16 years and older. There are some reports out there that children will start to be enrolled in studies, which for some of us is exciting, those that want some protection for children on this. Side effects are common with both of these. In fact, all 3 of these, and I'll leave that to colleagues moving in the next questions to answer those. But really what we see, and when we talk about side effects, we use the term reactogenicity. Reactogenicity is when you see a side effect of a vaccine within the first 7 days of giving it. So when we say the level of reactogenicity, it's typically higher when we give the second shot as opposed to the first shot. And that's true with both the Pfizer and the Moderna, some more so than others. So those are kind of some specifics about the mRNA vaccines. And then the J&J Janssen viral vector vaccine is just 1 intramuscular shot. Again, doesn't contain any eggs, latex, preservatives, those types of things. Approved for adults 18 years and older. And, really the similar side effect profile. So as far as viral vaccines, the viral vector vaccines, those are also a little bit different. A viral vector vaccine, which is the J&J vaccine, the 1 shot, It basically uses a modified version of a different virus, in this case, the adenovirus, which is the common cold virus, to deliver important instructions to our cells. And you might say, why would I inject myself with a cold virus? Why would I give myself the common cold? And what it does is actually, it uses the adenovector or adenovirus vector. It contains modifications that doesn't allow it to replicate and make you sick. But it does help to carry the gene from the coronavirus into human cells. And your cells can then produce coronavirus proteins, but not the coronavirus itself, to then mimic the virus, again, presenting and priming the immune system to help fight the infection later if the body encounters coronavirus. So again, it's all about how the body is being presented the information and then allowing the body to do what it does best, see it, memorize it, and build immunity and adapt to it. One important thing I want to also say here is that although we're dealing with somewhat new technology, things that are new to people's ears, the genetic material that's being delivered by these viral vector vaccines and mRNA vaccines does not integrate into people's DNA.
Yes.
So I think that's a very important thing for everyone to understand, because that can be concerning. And so as far as, when you are safe, as far as peak immunity after vaccination, when we look at the Moderna and the Pfizer vaccines, the mRNA vaccines, peak immunity is typically 2 weeks after the second shot. When we look at the Johnson & Johnson one, peak immunity is actually about 4 weeks after the single shot. When we talk about numbers, the efficacy is about 95, 94% respectively for the Pfizer and the Moderna shots after that time period once you've hit the peak immunity. And for the one shot, after the 28 days, when you talk about preventing moderate to severe disease after 28 days, the Johnson & Johnson vaccine is 66% effective, but it was 85% effective in preventing severe and critical illness 28 days after vaccination. So I think that's really important. And I know Dr. Laroche mentioned about the variants. I actually did read in some of the trial information that the Janssen vaccine did give some protection against some of the emerging SARS-CoV-2 variants, including the Wuhan H1 variant predominant in the US, the B1351 predominant in South Africa, and the P2 variant predominant in Brazil. So I think that, no matter how you're vaccinated, if you are vaccinated, again, that affords everybody the opportunity to not allow this virus to continue to mutate and, stop this and then get us all back to normal life.
Well, thank you so much, Dr. Sumner. You gave us a lot of information to think about. And I think the most takeaway point that you mentioned is that the vaccines are not live viruses or not attenuated viruses. And I think people really confuse that. And I think the hesitancy about taking it, people think that it's going to get them sick because this virus, they're thinking that they're injecting the virus. So the point of that, the messenger RNA, and Dr. Laroche spoke about the spike protein, that's what our body is seeing. And it's not the virus itself to make us sick. So thank you for that point. One other question of follow-up.
One other thing, if I could invest in one comment. Just I like visual things, and I know some people just like visual. And to mention what she says, if you look at this yellow sheet, and it looks like your cells. If you look at the disc that's in the middle, that's your nucleus. When you get a vaccine, the mRNA just remain outside the nucleus. It never gets inside the nucleus. Inside your nucleus, that's where your DNA is. So if you cannot get inside, it's not going to change your DNA. Because I know that a lot of people are concerned about this.
Mm-hmm. Thank you. Thank you. Dr. Durandis.
Yes.
Next question is for you. In educating and vaccinating your patients about COVID, what are some of the common side effects that you caution them about, that you've seen yourself? And should they take medicine in preparation for these possible side effects? Is it advisable for them to take pre-medication or post-medicate themselves if they should have a fever or some of the side effects? Could you talk about that for us, please?
Yes. Thanks for having me, by the way, Dr. Crevecoeur and all the other panelists. I think it's a great service to the community. Before I answer the specific question about side effect that people may have with after taking the COVID vaccine, and should they take medication or any precaution before they take the vaccine, I wanted to go back to something you said earlier that is a core question, and I get that a lot from people about the context those vaccines were produced. People like you think, oh, and the question you asked initially about where those vaccines rush. We want to make it clear for people to understand that the process of producing this vaccine is not different from any other vaccine that have been produced before. The context is this time we have more people putting head together and more funds, but the steps that we use to produce the vaccine, they were not skipped. I wanted to put that clear so people don't have the sense that, oh, this vaccine were rushed. There's a lot to be scared about. So it's important for our viewers to understand that. Now, talking about side effects of this vaccine, we want to make it clear, and I think Dr. Sumner mentioned that this vaccine, they don't contain additives. Additives usually are products that they put with the vaccine, other ingredients that can carry additional side effect and even allergic reaction. And those vaccines, fortunately, they don't have additives. So the side effects usually that I'm seeing with patients that are taking vaccine here in Miami is mainly side effects that you would see from any other vaccination, especially pain at the site. So usually the patient, they have pain, and it counts to 84% of the patient, they have pain at the site where they receive the vaccine. And usually it lasts from hours, and for a few patients, it goes to days. But mainly after a few hours, patients report that the pain is gone and they feel better. Another side effect that patient reports a lot, some of the patients, they get fever. Again, it's very transient, patient get fever, and usually a Tylenol or hydration is suffice to relieve the side effect. Another side effect that I've seen is headache. A lot of patients complain of headache. And usually, like I mentioned, it's not something that lasts days. And patient can take, again, Tylenol, very supportive measures that can alleviate those symptoms. And one thing I think everybody has in mind and is side effect that are not even side effect, but allergic reaction. So it's like eating pineapple for the first time or trying food for the first time. Sometimes you can expect allergies. Very rare for those vaccines to see patients to have severe allergic reaction. And that's the reason why after patients receive the vaccine, we ask them to wait for 15 minutes to monitor them, because those allergic reactions usually happen right away, but very rare. And we're talking about something we call anaphylactic reaction, which is a big word to say that patients get, they get problem breathing, they have itching, and it can be scary for the patient. But so far, like I said, it's very rare. And as far as one of the part of the question that you asked me, should they be prepared or take any medication? There's no special preparation when you have to take the vaccine. But I always recommend the patient to have good hydration the day they take the vaccine. And if that happens, they have one of the side effects that I mentioned, it would be important that they can treat, like I take it, Tylenol, or just supportive measures. So I hope that answered the questions.
It does. It does. But you also left me with more questions, because now my husband also had gotten the vaccine and he had no effects. So does that mean he's not protected? Because now some people are afraid that I didn't feel anything. I had no headaches. I had no fever.
That's
Am I
very
protected? Do I know if this even worked?
Exactly. That's very important. Myself, for example, I take the vaccine on December 16. I took the Pfizer, and I didn't feel anything. And I can tell you, yes, I feel protected, because I know I've been working on four different hospitals on the wards with COVID patients. And on top of it, I do hospice. I'm a hospice physician also. And I run a COVID-19 hospice. And I can tell you, the vaccine have helped, and I feel confident to tell all the viewers, especially our Asian community, that protect against COVID-19. And I would take the opportunity to tell them, please take the vaccine, don't wait, especially in our community, especially that we've seen like there's a lot of resistance in our community. And unfortunately, most of the patients that I've seen at the hospital, especially here in Miami, they have Haitian background. So we want to reassure the people, if you don't have symptoms, that's good. We don't expect you to have side effects, but if a few of you have side effects, like I say, hydration, drink a lot of fluid, and if you have fever or headache, take a Tylenol and you'll be fine.
And so you don't recommend people with no side effects to check for the antibodies, because that's another question that people are worried about.
No, I know a lot of people are curious to how do they know that it works, but I would not advise for anybody to check for those antibody testing to see if you're protected. First of all, there's a lot of cross reaction with those tests. So it may be negative or positive, that doesn't mean much. And most of the tests are qualitative tests, and you don't have a titer, so it doesn't mean much. So I think we should tell people not to be afraid. Those vaccines now, over 300 million people in the world have taken them, and here in the United States, you have over 100 million people who took their first shot, which is a good thing. It's still low, but I think that's a good start. And I think that should reassure people that it's safe to take the vaccine, and we should encourage people in our community to take it.
Well, thank you very much. Dr. Jean, the next question is for you. What is the benefit that you want to tell people of getting the vaccine, especially with someone with heart disease?
Hi, good evening. Thank you so much for the opportunity to participate in this panel. This is really great information to help to dispel many of the myths that unfortunately persist in our communities. And, one of the most important aspects to what I've tried to communicate with my patients is the importance of not delaying care. You want to make sure that you're staying with your healthcare provider team to get treated for both your physical condition as well as your mental condition. Because unfortunately, many of the conditions I treat that increases the risk for heart disease, which includes obesity, high blood pressure, smoking, but also diabetes, we know is an important risk factors. They end up being really important reasons that increases someone's risk for getting severely ill. And so the best way really is for prevention, by making sure we're taking care of ourselves, that our risk factors are treated, that we're taking our medications, and again, that we're seeking care. Because early on, unfortunately, patients were waiting at home and coming in very sick for many of these treatable conditions. Because, for example, in heart disease, we were able to make progress in improving outcome in our patients by making sure that we treat their heart attack early on. But then now patients are afraid to come to the hospital. They're not seeing their doctors in the office, and they're coming much sicker. I'm seeing patients with worse health conditions related to their heart care and their heart disease because they're staying away. And unfortunately, they're unaware that by not treating these conditions, they also are increasing their risk of getting severely ill and dying from heart disease. So both of them really they work close together. taking care of yourself and your risk factors also helps to reduce your risk for having a stroke and a heart attack, but also reduces your risk from COVID. And so we really need to continue to make sure that our patients stay connected so that they have better outcomes, because unfortunately, you know, Black and brown patients in our community, the Haitian community, we're dying at a higher rate from both heart disease and COVID. And a lot of it has to do because we're not treating these risk factors. And again, we're staying away because we're afraid of getting COVID in the hospital settings.
Oh, well. Also, initially, when the pandemic first started, we heard a lot of things about inflammation of the cardiac in athletes. And do we know what's the long-term sequelae of that? Do we know if it's reversible? What could you share with us about this with athletes?
Yeah, so that's a great question. Early on, there were a lot of concerns related to how safe it would be for athletes to go back to training competitively. And we were finding that the inflammation from the COVID can damage the heart, can cause inflammation of the heart muscle, in very rare cases can lead to congestive heart failure or a heart attack. But the more and more we've learned, and by patients getting tested, we're finding that it's not that common. It's rare. So the guidelines early on went from really screening everyone, doing testing, echocardiogram, ultrasound of the heart, stress test, heart monitoring was recommended for all of the athletes. But now things have progressed and the guidelines have changed to reflect that it's not so common. And thankfully, if the athlete recovers without any symptoms, mild symptoms, and they didn't end up in the hospital with severe illness, for the most part, they're able to resume their activities after that 2-week period of rest without extensive cardiac testing. But of course, as I always say, you know, you really do want to stay connected with your healthcare providers, and the school systems also have their own criteria in their program to make sure that you're getting the appropriate care and recommendations and clearance for when to go back to competing back in school.
Oh, wonderful. That's good news. That's good to hear. Yeah. Another thing, a lot of cardiac patients with cardiac arrhythmias or stroke or heart disease, heart attack, they've been put on blood thinners or daily dose of baby aspirin. Is that a contraindication to getting the vaccine, or should they stop their medication prior to getting the vaccine? Could you let us know about that?
Thankfully, it's not. So if you are on a blood thinning medication, the recommendation is to get your vaccine, and that also includes aspirin. So you do not need to stop those medications. And for many of the patients I take care of, they really do have an important reason to be on these medications. And so the threshold to stop it should be really high for the vaccine. If you are concerned, you can ask to see if they can use the very smallest syringe to do the injection. Afterwards, you should apply pressure for at least 2 minutes to make sure that there isn't significant bruising afterwards. And then there is a group of patients who take the blood thinner warfarin, where that one, you know, sometimes their blood can be very, very thin. So in those situations, if that blood is too thin, then you might want to delay the vaccine until it's within a proper range. But again, for the most part, our patients are able to successfully get the vaccine without any bleeding complication after getting vaccinated.
Thank you very much. Dr. Barthélemy, also at the beginning of this pandemic, we heard how people were having neurological symptoms when they got COVID-19, such as the loss of smell or the loss of taste. And what is the long-term prognosis for these patients? And are there any other neurological manifestation when people have gotten the COVID-19 disease?
Okay, I'm taking this question as addressed to me. I think part of the introduction was cut off.
I'm sorry.
That's okay. That's okay. I think I caught the question. So the question is about neurological presentations of the virus, what the prognosis is for people who have had those manifestations.
Yes.
And there was a third part. What was that?
And are there any other, what is the long-term effects of it? And is there any other manifestation?
Yeah. So great questions. There are still more questions than answers. I think the first thing to say is, in terms of a neurological presentation, you are talking about an exceedingly small minority of patients who become sick with COVID, at least based on the literature that we have available. So if we're talking about stroke, which is perhaps the most severe, or the various forms of stroke, one of the more severe complications, the data we have available suggests that we're talking about up to 1.4% of patients. The more common, less severe complications, such as anosmia, losing the ability to smell or losing taste, may happen with greater frequency. And in many patients, this is how they present with the disease. And it's unclear, to be completely honest, how long they can expect to live with these symptoms, what it will take for them to recover. Anecdotally, I've seen patients who have had recovery of all symptoms but smell. Some have had partial recovery. I suspect that there's a contribution of the comorbidities that people are suffering when they become sick with COVID. So we're still studying this. We're still trying to understand it. To group all neurologic manifestations of COVID in one category is challenging, because they can range from the anosmia we talked about to stroke, as I mentioned, to even some neurodegenerative disorders that are being actively studied, an increase in seizures for patients who suffer from a seizure disorder, and even neurological infections, so meningoencephalitis. And so each of these really does have to be treated within the context of the disease entity. And just as Dr. Jean mentioned regarding the cardiac manifestations of the disease, with a lot of the neurological manifestations, what you're talking about is sort of end organ damage from a hyperinflammatory or hyperthrombotic response. And so in that case, again, the comorbidities a patient has, the risks one has for neurological diseases will predispose them more or less to suffering that particular consequence of the virus.
And so it's a benefit if they get vaccinated, basically, because of all these.
Absolutely. Absolutely. I mean, I think, in terms of vaccination, the big question I would say for in the mind of the public is a question of risk. What risk do I run getting vaccinated? And if you want to look at it from the neurological standpoint, have there been neurological events or so-called complications that followed vaccination? Yes, there have been. They have been reported on the CDC's adverse events website, but let's be very clear about what we're talking about. The latest reporting for this website, which anyone can go to, because people can freely report adverse events after vaccination. As of Friday, there were 30,000 adverse events reported, with over 100 million people vaccinated in the United States. So what you're talking about is you take 1% and then you take 3% of the 1%, which is that exceedingly rare event. And at this time, we are incapable of saying whether or not that very rare neurological event would have happened anyway. There is no evidence whatsoever that there's any relationship at all between the vaccine and the neurological event. What we can say is that neurological complications of COVID, of the virus, are clearly far, far greater, pose a much, much greater risk to the unvaccinated member of public. So if you just want to sort of look at the hard numbers and wager a bet on what is better for your health, what's better for your family's health, what's better for your neurological health, there is no question whatsoever that getting vaccinated is the best thing you can do for the health of your brain.
Thank you so much for that. And I'm gonna leave neurological manifestation and go to pregnancy and breastfeeding, because although I know it's not your field, but it's a question that a lot of people have asked me. And so what is the CDC recommendation for vaccinating pregnant women and those that are breastfeeding?
Right. The simple answer is vaccination is safe, and you should get vaccinated. So I reached out to some colleagues who practice in your field, Dr. Cutro, and informed me to review the recommendations from the American College of Obstetrics and Gynecology. And they're very clear that just like the examples I sort of painted for the neurological case, it's a similar scenario for the pregnant and lactating woman. The risks of the virus itself, viral illness, are far, far greater than any potential risk related to vaccination. And if you permit me to bring it home a little bit, if there's any question in terms of vaccinating the pregnant woman, it would be around vaccination during the first trimester of pregnancy. So, the important development of the neurological system usually occurs during that first trimester. And, there is a theoretical risk. Dr. Sumner mentioned reactogenicity. The reactogenicity to the vaccine can cause hyperthermia and a fever-like illness that could pose a theoretical risk to a developing baby's nervous system during the first 3 months of pregnancy specifically. That risk, I would say, is still nowhere near the risk of the COVID virus during that period. So, again, in a specific case like that, there's another case if we want to talk about patients with neurological disorders that I can address, but that's a specific case where the answer is yes, get vaccinated, and do it in partnership with your family practitioner or your OB-GYN to strategize around what your specific situation is and what the best timing is to get vaccinated.
Okay, and just to go along following maternal health and women health is also an interesting question about mammograms, because studies have also shown that to delay mammograms. Do you want to talk about it, or Dr. Durandis? You were very, happy about it.
I think that's one of the questions that come up all the time when patients ask me, should they delay doing their mammogram and why? And the reason, the recommendation is to delay to 6 weeks to 4 to 6 weeks after you get the shots. And the reason is after some of the patients, and the reason I was anxious to answer is because it's related to the side effects. And one of the things that happen when people take the vaccine, they can have swelling of lymph nodes on the armpit. And if they do a mammogram right away, that may be confusing with signs of breast cancer, for example. Not that the vaccine is related to breast cancer. I want to clear that out for everybody. But for that reason, you would like to wait until the swelling goes down before you do the mammogram to avoid any confusion. So that's the reason. That's the primary reason. But we want to advise people, take your vaccine and wait a little bit to do your mammogram.
Okay. The next, Dr. De La Roche, did you want to add?
Yeah, the only thing I was going to add is really a mammogram is not an emergency. So therefore, your vaccine is what you need to take. And then just to add to what Dr. Barthélemy, and a slight correction, Dr. Durandis, I think one of the things that you get reactogenicity from is not the mRNA itself, is the vehicle by which that enters the body. Because that vehicle, I think Dr. Durandis meant, it doesn't contain a lot of additive, but it does contain additives, because that's the only way you can put the vaccine within a vehicle to get into the body. You have aluminum, you have salt, you have sugar. Some of these are already things that our body have, and aluminum I think it has to do with increased immunogenicity of the vaccine. So there are some, but however, it's what caused the reaction. But when it comes to women health, like Dr. Barthélemy mentioned, there is no really true study, so everybody's always going to err on the side of caution. But if you look at the vaccine, we vaccinate some women when they are pregnant. women have fevers when they are in their first trimester of pregnancy, and that doesn't, a lot of time doesn't affect the fetus. So it's vaccination is a key, and then vaccinate.
Thank you. Dr. Cayo, I'm not sure if she's with us, or Dr. Cayo. Okay, I think we lost Dr. Cayo. Her question was going to be mostly about access, because although the Black community has been hesitant of receiving the vaccine, but we also know that there's been some problems in the equity of access in the Black areas. And so my next question was about distribution and the phases that we were going through. And so any of you, and actually maybe all of you, I want to know how the distribution is going in your community, and how effective is it, and especially in the hard areas reach. Would anyone like to answer that question?
I guess, yeah.
Yeah, I think the government, at least in New Jersey, we have partnered with Princeton partners that got a contract with the government to make sure that the Haitian community doesn't miss the boat and they do get vaccinated. Because you're right, there are hesitancy in terms of the community, because where they have a way of thinking that's totally different. So, and then also their faith, so these are some of the myths that through the clergy, to the pastors, and then what the New Jersey, I've done a couple of seminars and Zoom recording in Creole and in English, where we try to disseminate that information to the community. Unfortunately, because with COVID, a lot of places are on lockdown. So therefore, you cannot go to the church and then have a pulpit where you can declare your message. You most likely have to go through their pastors to let them know. But there are efforts being made. I mean, I can tell you, our friends of mine have called me and says, hey, where can I get the vaccine? Because to go online to try to get the vaccine sometimes is very hard to do. So some of the things that New Jersey is trying to do is to go to the communities using, mobile van, like your mammogram van that go to your community, those people that cannot access. One of the things I suggested also, that we have a large pool of vaccinators in the fourth year medical students. They're already trained to give vaccine. Use them. Now the military is using, the government is using the National Guard to do that. So you're seeing more and more people getting into the community in terms to try to vaccinate people. So it's getting more and more better. Okay. The one thing I do mention to people, especially the Haitian community, you have diabetes, you have high blood pressure, you have kidney problem. Do not wait until later to get the vaccine, because as of May 1st, the vaccine is going to be open to everyone. Mm-hmm. So at that time, the line is going to be around the block. So if you have comorbid condition, please see your doctor. Have them give you a note. Recently, my sister-in-law called me and says, I'm obese. One of the questions they asked her when she went online is that, are you obese? Are you this? She said, I'm obese. So she called me. I said, no problem. I gave her a letter to demonstrate that she's indeed obese, and she had no problem getting a vaccine. So I'm willing to do that for our communities. And then I'm pretty sure, as part of the Association of Medical Abroad, we are really pushing to get our community vaccinated, whether our chapters in New York, our chapters in New Jersey, our chapters in Florida, and even a chapter in Montreal. We're trying to push the community to get vaccinated through any means necessary.
Anyone else like to add anything about in their community, what's going on, and how effective is the distribution going?
Yeah. Here in South Florida, I would say we are blessed to have a very strong Haitian community, and we do have a task force. People, physicians, nurses, and Haitian, ANA, they call it, Haitian Nurses Association. Everybody, we are involved in providing information to the community and using all platforms, social media, going to state, because we know there's a lot here in our community, and some of them, granted, but we want to help. And I think so far it's getting better. It's getting better, especially now recently. Here in Florida, you need, if you get a letter from your doctor that say you're vulnerable, that would suffice to qualify you for the vaccine. And we hope we continue to educate the community, even though, like I said, there's a lot of resistance, there's a lot of pushback, and some of them are cultural. You know, we all know what happened. The history between Black community in general and medicine, and also the Haitian community, resistance. I'm a poetitim, some things like that. But I think there's a lot of efforts being done in the community, and I would take the time, like I say, to salute my colleague from the Haitian Coalition Task Force who are doing a fantastic job, I would say, to help the community.
Okay, well, what about homebound patient? Because this is really dear to my heart. My mom is homebound after her third stroke. She's bedridden, and my wonderful brother in New York, Tony, and his wife, is taking care of her. But to actually bring her to the clinic or to a hospital or to CVS, it's hard. And so what are we doing for our elderly patients that needs to be vaccinated that are homebound? Is there anything that you could share with us?
Well, the Johnson & Johnson that just came out is going to be a game changer because it's one shot. The refrigeration doesn't have to be the same as the Pfizer or the Moderna. You can house it in your same container that you go around to give people vaccine at home if you do home visit. So it's really going to be a game changer in terms of home visit. And there are doctors right now that are doing a home visit. The thing is just adding the vaccine in their armamentarium to be able to get it. The thing is they have to apply to the state. I know I receive a lot of mail from Florida because I have a license in Florida where they tell me, do I want to give vaccine? If I need to give it, what can I take this course? So that way they want to make sure that the paper trail is done properly. And that's part of the problem, is doing the paper trail to make sure that we take accountability for every vaccine that we take charge of and it don't get wasted. One of the things that AMHC, we have advocated AMHC and some of the physicians that have been asking, can they participate? And they volunteer to give the shots. The thing is, it wasn't available then, but now with Johnson & Johnson, it's making much more. I can put it on my cooler and then just do a home visit and vaccinate whoever I can.
Does the viewers, do they know where they could call, or could you give an advice of who to contact?
Well,
somebody that's at home for them.
Okay, the best I would say for now, contact your state, the person, or at least for MHE, we have an MHE in all the different areas, at least the 4 major places where there's most Haitian community. You can contact us in amhe.org, and we'll be more than happy to find out for you. I will personally answer your call. In New Jersey, I carry the New Jersey phone all the time with me. And I tell people to give me a call day and night. If I don't answer you, I'll answer you as soon as I see your message.
You said something about paper trail. What about immigrants? Are they being vaccinated? What's the effort in trying to vaccinate immigrants if we're trying to get this herd immunity so that we don't have a lot of different variants?
Now, this is a political question you're asking.
No,
well, it's kind of political, but it's also medical because
the reason is, I said, this is the reason. The primary goal of the U.S. is to vaccinate its citizens and whoever is legally here. The problem with a lot of immigrants that makes it very hard, they don't want to show themselves because they're afraid of deportation. Right. I'm hoping with the change in administration that won't be so much an issue. So far, immigrants are probably on the last, but yeah, I agree with you. To stop the pandemic, we gotta vaccinate every adult. But that's the kick that at this point, at least I see from a governmental standpoint. I don't know if Dr. Durandis has anything from
No, I agree 100%. And one of the problems that we have here in South Florida, it's required to have a Florida ID to get vaccinated. And, unfortunately, that's that's heartbreaking when we know a lot of people from our community, they may not have that they may not be able to meet that requirement. But unfortunately, that's something we hope that will change, and that's an issue. Yeah.
Okay, at this moment, before we open up the questions, because it seems like we're having a lot of questions that people are writing in, which is great. I would like each of you to give me your final thoughts. Anyone could start with final thoughts that you would like to share with the viewers.
I can start. I don't want to monopolize the whole thing, but I can start. Luke 12 verses 48 says, to whom is much given, much is required. I've been blessed. God has given me life. Almost a year ago, I got COVID. 3 days before I got COVID, 3 or 4 patients admitted in the hospital died of COVID. So when I got it, you can see what's going on in my mind. I called my insurance company. I started to make changes because I said I'm next. There was no vaccine, no treatment. I was hospitalized once. My oxygen went down. I got better. I got sent home. 4 days later, and I don't know if anybody has had hiccups before, but from midnight on the 14th of April to 8 o'clock in the morning, I had non-stop hiccup. In the morning, my daughter had gotten me a pulse oximeter. When I checked my oxygen, it's what, 87%.
Wow.
I said to myself, Houston, we got a problem. So I immediately went to the hospital. And pour compatriote moi haïtien, l'homme arrivé à l'hôpital, oxygène était bas, rem te gen problème. Donc, on dit en Haïti, c'est sérum. Pendant toute une semaine, c'est sous sérum. I could not taste, I could not eat, just IV. When I finally was able to taste something, and I thought I was going to be on dialysis. Thank God it didn't happen. When I was able to taste something, I ordered, and this is the thing. When you go into the hospital, my 2 sons drive me up, and I'm sitting in the back of my car. I'm looking at my 2 sons. I said, man, check this out. I'm used to want to be the one driving them. Now they're driving me. So they get me to the hospital. As they enter the door, they said, Dr. Laroche, you can go in, but your kid cannot go in. I said, uh-oh, we got a problem. So I end up in the hospital by myself, alone, with all my family wondering what's going on, and I'm not feeling well. After a week in the hospital, I ordered a tuna melt. Man, I never knew tuna melt tasted so good. That was the first time I ate something. I ended up going to home on oxygen. I was on oxygen for a whole month. When I got home to protect my family, they put me down in the basement in a little room. They would put the food behind the door, and I will open the door and grab the door. I thought nobody wanted to touch me. That's how bad it felt. But God was willing. Slowly I got better. And what hurts more is that after I've been in the behind closed door for 30 days, I heard my grandkids saying, Grandma, we haven't seen Grandpa for a whole month. What happened to Grandpa? That hurts. That hurts a lot. So, but thank God, we got better. The one thing that saved me while I was in the hospital, I keep on saying to myself, the Lord is my shepherd, I shall not fear. A friend of mine called me. They sent me a song that I never heard before, but man, was it a lifesaver. Every day I would sing that song. I would try to get up. And then I'll give you a taste, a 15-second taste of what the song like. When you hear it, you can tell me. Waymaker, miracle worker, Promise keeper, light in darkness. My God, He's you. That's what saved me. That's what saved me. So,
Dr. Laroche, thank you.
I will not wish this beast on anyone. So, if you can hear from me, I wanted to give my testimony. Like I said before, to whom much is given, much is required. God has saved me. A lot of people died. Another Haitian, his wife died yesterday of COVID because she didn't have time to get the vaccine. Please get the vaccine. Don't let it affect you. Not only affects you, it affects your family and everybody around you. So protect yourself, protect your family.
Okay, Dr. Laroche, thank you so much for sharing this personal trauma with us. I mean,
no problem.
So we appreciate that. For the rest of the panelists, we're going to have to really cut it short for your final thoughts, because I do want to get to the questions that are being posted. Okay. So any last thought? And if some of you don't want to answer, that's okay. But if any last thought that you want to share with the audience.
Dr. Crevecoeur, I just have something. I think that it's very important that no matter what you're hearing out there, there's a lot of news coming from different sources. There's all things on social media. It's very important to just ensure that you're getting your information from correct resources, things that have been peer reviewed, things that have been looked at, people that you actually trust, like your physicians or people that you know actually know something. There are a lot of things that are sensational out there. It's easier to believe bad things for whatever reason, especially about new things. So when we hear bad things come up, we have to understand that there are appropriate and there's a really good network of vaccine safety reporting that happens after vaccines get approved, and that is in place. And when bad things happen, it will come out. No matter who it happens to, it's going to come out. And so we will know about it. But if it's always happening on back channels or social media and not happening in the mainstream, question it is what I want to make sure everybody just, has in the back of their mind.
Okay. Dr. Jean?
Yes. Thank you, Dr. Laroche, for telling us about your testimony, because one of the things, obviously there's a lot of misinformation about the vaccine, but we're learning more about the long-term residual effects of COVID. And so there has been a lot of reports about the long hauler syndrome. And one of the roles that I've been able to participate in is in my group's or my institution's MedStar's post-COVID recovery program. And we're seeing the number of lives that have been devastated and ongoing. This is patients who've had COVID and 6 weeks later still having brain fog, fatigue, lack of energy, chest pain, shortness of breath. Even during their illness, some people have broken tooth or losing their teeth from just a significant inflammation. And we know about the long-term lung issues with the scarring. And what's been interesting is that women are more likely to have these long hauler symptoms, as well as patients who just had mild symptoms. So it's not always the patients who end up in the hospital severely ill. It's the young patients, and I'm seeing them in my practice, and their quality of life is significantly impacted several months to even a year later now. So even though many of my young patients don't think that they're going to necessarily get severely ill from COVID, we have to remember that this disease, there's still so much we don't know about it. But what we're learning is that the symptoms after even mild infection can really prolong and impact people's quality of life, and be very expensive to see all the different doctors that they're needing to see for ongoing care. Wow. So another important reason to really consider getting vaccinated.
Anyone else want to give us last minute thoughts before we go to questions? All right.
You see those 2 pumps? I'm never an asthmatic, but now I cannot live without them. A year after having been sick, I still have to use them because I get so short of breath.
All right. So I'm going to go on to questions, and I also wanted to again thank our partners, Chocorella and the the Right Accountancy for partnering with us, and also the NAAHP for bringing us this. So I'm going to go on to the questions at this moment because we have quite a lot. Did you want to say something?
Yeah, the key messages that were put up, I wanted to briefly comment about them.
Oh, okay.
Okay, and I'll be rapid. I know we're under a time constraint here. So basically, there are neurological complications that have been reported. They may occur. They are extremely rare after vaccination. And there's no evidence right now that vaccination causes any of these complications. This is important. But we have evidence that the virus can have severe neurological complications. The leading medical societies for neurological health in the country say that there's no contraindication in terms of neurological disease to getting vaccinated, and all individuals, regardless of prior neurological disease, should get vaccinated. There are certain conditions where we should strategize about when that vaccination happens just to maximize its effectiveness. So, I'll leave it at that, and why don't we go to the questions?
Okay, well, I'll start with you with one of the questions, because there was this 87-year-old woman who had 3 strokes, and they wanted to know at this point she should get vaccinated.
This is very similar to the question you had about being homebound. So, I think the how to do it is an important question as well, and Dr. Laroche addressed that. But should she? 100% yes. In fact, I would say this is, in my mind, a high priority patient for getting vaccinated. Her prior strokes put her at an increased risk of a stroke or other neurologic complication or other complication of the virus. And so absolutely, she should get vaccinated.
Okay, thank you for that. We have another question about, can you become infected after being fully immunized and develop severe disease?
Well, the efficacy is only, it's not 100%. So you could be one of the 5% or the 15% that does develop severe disease, potentially. So the answer to that is yes, there is that possibility.
But of course, that should not stop you from, of course, getting the vaccine. Okay. This next one is, why are some people dying after receiving the vaccine? Additionally, is there a certain person or blood type that the vaccine causes greater illness to, even leading up to death?
I will answer briefly and then welcome any other contributions. So I can understand the great fear and lack of trust, particularly, given, what the last year was like in this country, that people have in the healthcare system. And so that's going to transfer over, unfortunately, to like an opportunity like getting vaccinated, that people, in our own families, like in Haiti or other developing countries, don't even have the opportunity, right, to get vaccinated. So remember, people, this may come across not the way I intend, but people are going to get sick. People are going to die without getting vaccinated, right? And it's very important for us to separate what is going to happen anyway, so to speak, from what is happening because someone got vaccinated. It's not the easiest thing to do, to demonstrate, does getting vaccinated actually cause these adverse events? But right now, the evidence that's coming in is not supporting a very strong link between any adverse event, including death. We have an enormous number of people getting vaccinated, thankfully. We need many more to get vaccinated, and people are going to look anytime something bad happens. But it's important for us to remember that that because it happened after someone gets vaccinated, certainly does not mean that the vaccine caused it, and most likely it didn't.
Okay. The next question is that the AstraZeneca vaccine was recently rejected by Europe due to issues with blood clotting. Can you speak to what this means for the public as we continue to hear more about adverse side effects?
If I may answer, I think there's a legitimate concern about blood clots related to vaccine in general and the vaccine that AstraZeneca produced. Just to be clear, it's not authorized yet in the US. So that's one thing people here don't have to worry about it now. But of course, we need to have more information. But I'm clear, I think AstraZeneca, as they put out a paper that said, claiming that it was not related to the vaccine. So I think for this, we need to have more information. But as for now, this vaccine is not authorized in the US, so that may be a little bit reassuring.
Okay. This one is a question about gathering that I was asked before. And there are going to be 3.7 million high school seniors graduating and almost the same number of college students graduating. And my two sons, Joseph and Nicholas, are among the college kids that will be graduating this year. So my question is, can I celebrate with them? Can we have a small gathering? Could we have a large gathering? Because if everybody is expected to get the vaccine by May 1st, and they don't graduate till like the end of May, beginning of June, in theory, if we're all vaccinated, what is the harm in having a celebration?
I think if we look at the CDC guideline, what they recommend now is if you're fully vaccinated, immune, people who are fully vaccinated can gather in small groups. That's permissible. But as far as, like we mentioned, May 1st, not everybody will get vaccinated, but I guess everybody will have access to a vaccine, I would say. And that's a big difference. So how long that's going to take to vaccinate a lot of people, and time will tell. But definitely, we will tell people that's one more reason to push to get the vaccine as quick as possible, so we can have gathering again.
And I would add, for the patients who are high risk, the older patients, or especially in those gatherings, if you're having people from multiple different households, then of course continue to do the additional CDC, guidelines of face masks, washing your hands, socially distancing as possible, so that it can be more safe and to reduce the risk of of those patients getting severely ill. But part of what we're seeing is the mental health illness part of this. The isolation has been really detrimental to many of the patients I'm seeing. And so the more that we can start to transition, getting vaccinated, doing many of the things that leads to better health outcomes, which is family and better mental health and treating people's anxiety and depression, I think that also will be an additional benefit for us all.
This is another question about booster shot. And that was pretty interesting because that's something that I wanted to cover also. We've been hearing that with new variants coming around, we may need booster shots in the fall. Do you want to respond to that? And how is COVID in California now?
The thing is, if you look at the flu shot, every year we get flu shot. It's slightly different than the flu shot of the year before, just to cover, because we're trying to be ahead of the virus. So I would not be surprised. And then, as a matter of fact, Dr. Fauci is mentioning it, you are going to need most likely a booster shot just to cover the variants or the G strain that's coming out. That are, again, as we mentioned, those vaccines right now are not fully effective, are very much less effective against those variants. So most likely you are going to need a booster shot. The California thing is going up and down, so it all depends on what they decide to do. If they continue to, beside the vaccine, one thing I must mention, mask. You have to continue with the masking. I know there are states like Texas who suddenly decided that they're going to open no masking, but that should be a continue until everybody is fully vaccinated. I think that's one of the first barriers to keep this strain under control.
Okay, the next question that we could see is, what would you say to healthy young people who would like to get a vaccine but are not currently eligible for one? And should we try to get a vaccine that would otherwise expire, like Pfizer or Moderna?
I'm not sure what they mean by expire, but again, younger people, by and large, tend to be less risk to get sick than elders. So I think the progression they're doing now is you got your health workers, you got your teachers, you have your over the 65, and as you get to your young person that are not in the front line, then I don't think there's a problem. Now, one of the things that this person may be mentioning, and maybe some of the panelists can address it, is that I got the Pfizer vaccine, and when I went to get the second shot, there's no more. Can I get the Moderna or the Johnson & Johnson? You can get the Moderna, but however, you cannot get the Johnson & Johnson because they are two different vaccines. The CDC doesn't mind. It's not the required practice, but if we get to a place where there's no more Pfizer and the only thing that's Moderna, yes, you can get the second Moderna shot, but you cannot get the Johnson & Johnson because they're not compatible.
That was one of the questions that I had coming up too, because that is, people have asked about that. What if I forget what I got before? Was it the Pfizer? Was it a Moderna? Could I mix the doses? But another question about the doses that I've heard is that what if you don't go back in 21 or 28 days? You go back 2 weeks later. What are the consequences that people fear, if they don't take that strict 21 to 28 days with the Pfizer and the Moderna? What happens?
Actually, go ahead.
Go ahead, Doc. Go ahead, Doc.
No, actually, really nothing happened. However, if you look at the curve of the first vaccine, when you give the second vaccine, you try to give it right before the first one start picking down, so that way you can have that booster effect. Now, if it start going down, and then you get we probably will be okay. But the only way, I don't think they have done that kind of study. So to be scientifically driven, the study that I've done is when you get to 21 days or 28 days, depending on the vaccine, you're supposed to get the next one. So that way you still get that booster effect. So you get to 95%. My wife was asking me, he said, well, why can't the Johnson & Johnson be 2 shots? Well, the Johnson & Johnson could technically be 2 shots if you're looking at the theory that's 75% and get it higher. But any vaccine that's more than 60% effective, usually it's a good vaccine. This is the first time, and again, because of technology, that we have vaccine to the level of 94, 95%.
But the other thing to this, important to know, like Dr. Laroche is saying, we are physicians on the front line. We're not scientists. So we're taking the studies that were designed for us and we're bringing them to the public. We don't know why necessarily they were 2 shots or 1 shot. We know why they work, how they work, and the efficacy based on the trials that were conducted. I'm sure there are scientists behind the scenes that could mix it up, but this is what they gave us.
The next question is pretty interesting because I've heard similar things too. They say not to take ibuprofen prior to the COVID-19 vaccination. After her second vaccination, my wife took Tylenol for her flu-like symptoms. Will that impair the efficacy of the vaccine for her?
No, not at all. Dr. Jean?
Okay. Yeah, so based on the CDC and other recommendations, they do advise to avoid the non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, before the vaccine. And their thought is your body needs to react and to sense the infection. Since not the infection, since the protein to make the antibodies. So when you're taking these drugs, it's reducing the amount of inflammation that your body is producing. And there are some studies in mice that showed that patients had a little bit less antibody production when they took it in advance. And then there are some other studies suggested in children that when they are pre-medicated, that they too had less antibody response. But after the vaccination, actually clinical studies, patients did take medications like Tylenol to help alleviate the symptoms. And so as far as we know, it is safe to take the Tylenol if you have severe symptoms. But of course, that's previously discussed, try to do some other alternatives to alleviate the symptoms. But from our experience, it's likely fine to be able to take Tylenol, but it's preferred Tylenol over ibuprofen should you develop any side effects.
Okay. And the next question, I believe we addressed that when we talked about pregnancy and breastfeeding women, that they should be immunized. and that, yes, it is possible for the fetus child to gain immunity. Not long-lasting immunity, but they do say that there is some benefit in having that. So I answered the next question. We have, there's another question. There's no maximum interval, it seems. It's recommended to get the second dose regardless if you miss the recommended interval. And yes, we did say that. Just like Dr. Laroche says about by the time it's starting to come down, you should get your second vaccination. If you don't, we don't advise it, but you're right. You should still get it even if you don't fall into that time period of the 21 to 28 days. So I believe we addressed that question also. And now there are a few panelists that didn't have a chance to say their final thoughts. So we have about 4 minutes left. Do you want to address the viewers?
Yes. So I just, first of all, I want to thank the National Alliance of Health Patient Professionals to invite me, and I'm so proud to see the great work that you guys have been doing, and I did my research. So thanks for all that you're doing in the community, and especially bringing awareness about COVID-19. Like I say, here in South Florida, there's a lot of resistance, but also COVID gave us an opportunity as Asian professional to help our community, to go beyond what we do normally to be involved, especially people that are very introvert like me, able to participate on a lot of platforms, a lot of activities to make sure that our communities are aware. And I'm so proud to see all those doctors, Dr. Barthélemy, a pleasure to meet you, Dr. Jean, and Dr. Laroche, and Dr. Sumner, right? I think I got it right. And Dr. Crevecoeur. You know, my best friend is a Crevecoeur. So yeah. So I'm so happy to be part of this. And I think the take-home message is not only for our patients, but for other young physicians, young healthcare professionals to be more involved in the patient communities, because people hear information from all over the place, but they feel more comfortable when the information comes from someone they can relate to. So I think I would encourage everybody to continue that great work. And again, a pleasure to be with you, and hope that message can reach a lot of people. And please, people, take the vaccine. Take the vaccine so we can go back to a sense of normalcy. Again, thank you.
Any last thought? I think we have time for one more person to tell any last thoughts. Well, if there's no more.
No, I'll tell you. Bon, frère ma soeur, nous samedi à soir. Nous devons dire une vérité, pas de menti. Tout ça Abdullah, c'est ça nous gain devant nous. Nous avons expert haïtien qui parle avec nous, qui dit ça qui passé. So, if anything, from what we tell you, we try to elucidate what's going on. Please take the vaccine. Don't hesitate. Take the vaccine. Because what happened to me, I don't want it to happen to anybody else, any of you. I love all of you guys. We're all from the same. Now, one last thing to tell people in terms of vaccine. Do you know that the vaccine, the methodology to vaccinate people in the West, who developed it, who came with the idea? He was a slave. His name was Onesimus. In the 1700s, Boston had a big thing of smallpox.
Yes.
In Africa, what they did, he explained to his master, in Africa, what they used to do, they used to put a cut in the skin, take the pus from the cow pox, rub it on the wound, and that protect them from getting smallpox. From there, Dr. Jenner from Britain became with the idea of vaccination, and there come vaccination. Now, Onesimus never got a dime because he was a slave, but everybody else profited from his idea. So just some little historical perspective. So don't be afraid. We developed the vaccine. We developed the way. We've been leading it. Don't be afraid. Take the vaccine.
Thank you.
If I may add something quickly, along similar lines, Dr. Agnes Binaguajo, who is a public health and global health champion, quite frankly, in the country of Rwanda, has been leading the charge to get the Rwandan population vaccination, which is another feather in their cap, and is very reassuring that those of us of African heritage don't have to fear anything about the effects of vaccination. And in fact, it behooves us, given our elevated risk as a Black population, to get vaccinated as quickly as we can.
Well said.
Thank you so much, everyone. Thank you, my viewers, and thank you, my wonderful panelists. This has been a really great discussion, and I hope that a lot of people learned a lot from you today.
It was our pleasure.
Thank you. Bye-bye.
Good night.
Good night.